Hello, I'm Dr. Jodi Freifeld with One Health Kansas at Kansas State University. Today, I'm at the Kansas Department of Health and Environment in Topeka, Kansas with Dr. Ingrid Garrison, the State Public Health Veterinarian. Hello, Dr. Garrison.
Hello.
Dr. Garrison, can you please tell me a little bit about the KDHE and what it does?
The Kansas Department of Health and Environment is the state's public health authority. It's best summed up by our mission statement, which is to protect the health and environment of all Kansans by promoting responsible choices. KDHE is responsible for ensuring that you have safe drinking water, the air you breathe is clean, and to protect you from infectious diseases, as well as to help understand the chronic diseases that affect so many Kansans.
Can you please tell us a little bit about your role as the State Public Health Veterinarian?
State public health veterinarians provide a crucial role to protect public health. There are approximately 150 diseases in the United States that are zoonotic, and zoonotic diseases are those that are transmitted between animals and man. Approximately 75% of all new and emerging diseases all around the world are also zoonotic. So you can see veterinarians play a very important role in the prevention and understanding of these diseases. As you know, One Health has been a term that has been used very recently and is incredibly important in trying to bridge the gap between human health and animal health. And state public health veterinarians are that bridge.
If you suspect that there has been an outbreak of a disease, what do you do?
Any outbreak of any disease is required to be reported to KDHE. And what happens once we hear a report of that is we confirm whether or not there really is an outbreak. And in order to confirm this, we contact the healthcare provider who may have seen a patient, or we contact our local health department, who is a critical partner in these efforts, and we will ask that they follow up to find out, is there really an outbreak occurring? That is the first step, and it is really crucial, because if there is not an outbreak, then you don't want to expend valuable resources in chasing something that may not exist. The second step is to start collecting information about this person or persons who may be ill. And this is where becoming a disease detective comes into play. You need to find out who this person is, how old are they, where do they live, what activities do they participate in, do they have any animals? It seems fairly overwhelming with all of these questions that I'm posing to you, but how you will narrow down what specific questions to ask is by understanding what disease you think they may have. Once you know the type of disease that they have, you can narrow it down by how that disease is transmitted to ask those specific questions. It really is actually quite exciting because you're a race against the clock. You want to make sure that you know the disease and are helping the healthcare providers to potentially make a diagnosis by coordinating sample submission to CDC for further testing if that's needed. And those tests that came back may mean the difference between this person getting well and this person not getting well by getting the appropriate treatment. You're also in a race against the clock to make sure that there aren't additional people who are becoming ill. What happens if this outbreak is not localized just to one city, county, or state? What happens if it's a national outbreak or even an international outbreak?
In addition to responding to disease outbreaks, do you do any kind of disease surveillance to look for new diseases?
Disease surveillance is an important part of public health. We need to find out really what's happening out there, but there are so many diseases, we narrow that down. And a great example of one of the many types of surveillance that we conduct is through the influenza-like illness network surveillance. This surveillance system is sponsored by the Centers for Disease Control and Prevention and is in every state. And we have a network of healthcare providers, such as doctors that may be your local family doctor. It might be a doctor at a hospital, it might be a pediatrician. And we ask these doctors to submit samples that they take from people that they suspect to have the flu. And we request about 2 samples a week. Those are submitted to our state lab where they conduct tests on those samples to determine what type of influenza that person may have. Then that information is then transmitted to the Centers for Disease Control and Prevention, and they compile this information nationally to determine what flu strains are currently happening, and they can also project what they think will happen for next year. And that is how they determine what strains of flu go into next year's flu vaccine.
Ingrid, thank you so much. You've really given us a much better understanding of the KDHE, the Kansas Department of Health and Environment, and your role here, and what occurs during investigations of disease outbreaks. If you have any other questions about the Kansas Department of Health and Environment, please visit their website for more information. Their website is at www.kdheks.gov.